Hi, I'm Erika Arteaga Cruz, talking from Quito, Ecuador. The People's Health Movement Extractive Industries Circle tackles a development model. What it's about is like to position extractivism as a mode of accumulation that favors extraction of natural resources, for instance, minerals, or it would be oil or fishing industries, forests, farming, from countries of the global south that export their resources. And this extractivist project began to be structured in the conquest and colonization of America, Africa, and Asia. All these people have been resistant now this mode of development that is not only how to be more sustainable or how to tackle climate change, for instance, with what you call the stop investing in the oil industry, for instance. Yes, we have to stop investing in the oil industry, but the same investment in green energy with the same mode of accumulation or the same mode of consumption of people, exploiting people from the south, taking away lands, territories, contaminating the Amazon region. It still affects us, and it's not only about whether we produce green energy. It is a mode of consumption. So tying these struggles, we in Latin America, I am from PHM, Ecuador, have been positioning a new sense of how to live good. The good living question was developed by the indigenous peoples. And it is not only a welfare state, it goes beyond the welfare state, because the welfare state is based on nation states, but this good living not only respects indigenous territories, indigenous practices, another mode or ways of living, but also respects that. What I am trying to say is that it's not enough to question our sources of energy production and tackle only oil. It is very important to question the colonization, the occupation of indigenous territories, the same structures that are still oppressing peoples from the conquered till now. Joining all these struggles, which is the anti-colonial, anti-fascist, anti-extractives, bring us help with other modes of living, other ways of production, and other kinds of ways that we relate with nature, because it's not only our material source, but in the indigenous vision and in summa causa is also our spiritual source. We depend and we defend life. That's kind of, in simple lines, what the Extractive Industry Circle talks about.
Hello, I'm Amulya from PHM India. As we know that PHM is a global movement, and under this this thematic circle, we try this recent post People's Health Assembly 4 from Bangladesh, Dhaka. What we try to strengthen this whole campaign from environment issues and health issue. We are trying to bring this whole struggles to a larger struggle, bringing about the environmental struggles, bringing about the workers' health issues, trying to bringing about the indigenous people rights, because if you see lots of extractive industries and illegal minings is happening across the globe, not only in India and the Canada and all that. So this has a larger impact across the various countries and regions. If you see in India now, the nuclear power plants has been promoted, and for them uranium is a major issue. The uranium export is going to be happened with the Canada. So this kind of the linkages what we are trying to do as part of this whole thematic circle. What as PHM Global we want to bring not only the health movement, but also the whole focus of this circle is to also strengthen the other movements working on other issues like land rights issues, like workers' rights issues, as well as like occupational hazards, the minings. There are large number of minings is happening. we have been successfully led lots of struggle in either in PHM Canada, Ecuador, in India. In India, for example, there is a larger indigenous tribals who migrate to quarries industries and illegal minings, and they get exposed to issues called silicosis, occupational health hazards. And we are successful in bringing justice to these indigenous people, closing down various industries, quarries, as well as provide them compensation, and now also bringing down the policies at a state level for these workers, those who are working in organized sector. So environmental issue has a larger impact, and then across this, when the PHM has started this this thematic circle across the in various regions, we are able to strengthen various campaigns. We are also able to bring lots of other struggles to this health movement.
I'm Sarah Shannon. I'm going to talk a little bit about some of the history that led up to the formation of this extractive industries working group. So there was a Second People's Health Assembly held in Ecuador in 2005. And activists came together from Latin America, Asia, and Africa. And there was a subgroup of us, of people who had been working on oil and mining issues, who arranged to meet there. And our hope had been that we might find some common ground to build a campaign together. And what we discovered in that first meeting was that there was, and I think this is a challenge with any kind of a global movement, which is finding that common ground and that common space. So what we discovered was that there was very differing strategies among those who were attending in terms of the way that they were approaching oil and mineral resources at the time. And one group was definitely from a point of view of, we just needed to stop all oil and mineral extraction. We needed to leave it in the ground. Another group was coming from the point of view of stopping extraction entirely is just not possible financially, economically, or for power reasons in their contexts. And so they were advocating for something along the lines of, what we can do is attempt to ameliorate the harm. We can try and reduce the environmental impact, the health harms associated with extraction. We can protect workers better, and we can try and contain and retain as much of the multinational profits being redirected towards those purposes. There was a third group of people present who were coming from a point of view and a set of struggles that were more along the lines of, there's a trade-off here. We can extract some of our mineral wealth, which is a national good, and then convert that wealth into something that we're directly using to improve the health and living of conditions of the poor in our country. So kind of a nationalist perspective in that sense, that called for a judicious use of extraction to directly impact those most affected and the poorest of the poor in their countries. So obviously, those were very different points of view based on the kind of context that people were working and living in, and from Asia and Latin America and Africa. It was a very interesting discussion, but it was clear at the time that there just wasn't a lot of space for common ground with that kind of differing strategies. And we really couldn't move past that to come up with something that we could do together as a campaign. So what we ended up doing during that the Second People's Health Assembly in Ecuador was to pivot towards a focus on the right to water. But addressing oil and gas and mining and other extraction didn't really move forward within People's Health movement globally until the lead up to the Third People's Health Assembly, which was held in Cape Town, South Africa in 2012. Through that process, we discovered and established very common experiences for health activists working in extractive issues. Their own challenges to bring health into extraction, regardless of what the strategy and context of their national situation was, and also a very strong shared experience of violence and repression that was truly universal in all of the experiences. There were activists, probably 25 to 30 activists from 15 countries, and that was really a universal thing. we built on that shared experience we'd originally only planned about a 2-hour meeting, and it turned into a series of meetings that probably was 10 hours in total, where activists began to share their own differing understandings of strategies and began to hear each other's points of view more. It led to the creation of a consensus document, a consensus statement about extraction that was read out at the Third People's Health Assembly. And that consensus statement really does reflect a growing shared understanding of both a broader sense of what is extraction, as Erica was describing, and also a willingness to sort of go beyond specific country strategies to build solidarity together that looks at the connections across specific struggles of very specific mining and oil and other extraction. So Baj, I wonder if you want to pick up from here.
Hi, everyone. I'm Baj Mukhopadhyay. I'm with PHM in Canada. And I wanted to talk a little bit about the issue of solidarity and how the People's Health Movement Extractive Circle across the world has worked on solidarity or worked towards solidarity in general. The relationship with Latin America has been really, for PHM Canada at least, and probably for PHM USA, but I can't really speak to that, has been really fundamental. I'm not someone who had an interest or a knowledge or an understanding of the issues of the health implications of extraction on a really broad sense at all until I went to the People's Health Assembly in Cape Town. And it was there that I first came to recognize the role Canada in particular played in Latin America and health concerns there. And it was really quite, it's really quite a marking moment in my own life as a development as an activist in being, I was the only Canadian in that space at that time and being told directly that, you know, most of our health problems are related to these mines. Most of them are Canadian owned. You in Canada need to get your act together. And that was a real kick in the pants for us. I don't know if Erica remembers the sort of impact she had on me, but I remember Erica from that assembly. And that's really been a key thing for me as my development as an activist, like, oh, I need to learn things. I need to get better at doing this because there's people like Erica who I'm in touch with, who I see regularly at things like this, who has an expectation that I'm doing my bit. And I think that has been essential as well. So that sense of accountability and the fact that there's like a personal relationship to build that with. Globally for PHM, I think PHM itself as a global movement has come a long way. I think there was a lot of difficulty in getting the sort of the structures of the movement to understand the importance of extraction in its really broad sense and the impact it has on health. It didn't necessarily fit into the kind of traditional analyses that PHM tended to use to look at problems around health justice globally. But I think with the concerted efforts in the Americas for sure, but also in India, in sub-Saharan Africa, and increasing the sort of struggles that people were beginning to see in Southern Europe as well around extraction, that sort of persistent work we've been doing and sort of like coming back and saying, no, we do need to understand these questions of health justice with the analysis that Erica sort of proposed at the beginning, that you know, it is also a critique. This is one way, this is one approach of a critique of capitalism that may not reference Western scholars or Western thinkers, but is grounded in an indigenous vision. It is also a critique of capitalism, which PHM is quite happy to do, but that's not necessarily, Marx isn't the only way to do that, for instance. It's hard to say what's tangible in what we produced, but there's been a lot of understanding and analysis and relationship building that's gone into it that's been very, very helpful. And it culminates in things like last September in Ecuador, when there was a case going to the Constitutional Court in Ecuador on the right of a province to hold a popular consultation on whether a mining moratorium was feasible or not, or wanted or not. You know, PHM Canada, I don't think even like 3 or 4 years before we would have been able to, but within a week, we'd managed to pull together a legal brief in support of the popular consultations, you know, got it written with a pretty solid analysis, got it translated into Spanish, and we had it ready. And that sort of concrete it felt like a very concrete, tangible thing we did that was in solidarity with someone, with someone's struggle. And none of that would have been possible, I don't think, had it not been for the years of relationship building and self-education that had gone before, that were grounded in relationships of accountability.
Just to add to what Bash was just telling us, the amicus curiae that we developed last year didn't actually work that part, but now our comrades, our compañeros in Cuenca have one after submitting again with all a lot of facts, building together. We won now the constitutional right to ask the people in Canton Cuenca if they want to have mining. So the struggle goes on, and it's like one step forward, 2 steps back, but we are still going on. And also, we're still going on with another sharing our knowledge with each other. So now, for instance, we in PHM Ecuador, and in coordination with the Extractive Industry Circle and with the Association of Asociación Latinoamericana de Medicina Social, are holding an IPHU, International People's Health University, that's teaching or trying to share knowledge with health professionals, telling them how extractivism affects health and how they are can or will manage that in primary healthcare. And I think the same thing is going on in North America. Bash?
Yeah, we're planning a series of webinars linking the struggles that happen across the life cycle of a commodity. So it's not just in the impact of extraction in the communities who are dealing with the mining or the extraction themselves, but the products usually have a knock-on effect on people's health. Amulia also mentioned, there's indigenous people in northern Saskatchewan and here in Canada who we're working with who are resisting the extraction of uranium, but that uranium ends up going to fuel nuclear power plants in India near fishing villages, and the fishermen and the fisher women are trying to push back against that. So we're trying to make those links across different struggles as well, just to show that it's not just right where communities are struggling against the extraction, but that there's an entire sort of structure and system that needs to be struggled against, as Erica was mentioning earlier.
And it's a mutual learning process. So it's not an expert panel also, it's how to link the struggles in the territory with academic processes and with health at all. We would like to finish inviting all of you who are interested in joining our efforts, in learning from each other, to come and integrate with us in the PHM Extractive Circles.